Hi everyone. So let's wait for a couple of minutes. Let's get some students here. And then in next like 2 to 5 minutes max, I think by 12:40 we'll start the session. All right, sir.
Yeah, sure. Hello, everyone, and looking forward to the session. A lot of queries have come, so we thought we'll have a short session discussing about the various queries that students have sent us. Good afternoon, Adit. Let's see if as people join, we'll start the session. I think we can start, Dr. Nachiket.
All right, sir. Hi everyone. So basically today's session, so I think we should wait for a couple of more minutes.
All right. Okay, until the students join.
All right. So
Yeah.
basically, so you were telling?
Yeah, please go ahead. You were saying something.
So hi everyone. So basically today we are going to have this session based on two different aspects. One will be completely on the non-academic side regarding the complete Q&A that you might have for the NMC draft, and then we have the legend himself here, Dr. Thameem sir, to guide you specifically on the academic basis that how and basically how you can get yourself much more prepared for the next exam, and how, for example, if you're talking about medicine, how for the last 3 years itself we have been inculcating the points that NMC has put in this particular program, and how we have made integration already a normal thing in Bhatia. All right. So the takeaways from the latest NMC draft. The takeaways from the latest NMC draft. First, I'm going to explain everything, and then we are going to have a Q&A session. First of all, please understand that no date, year, or batch has been specified for the launch of NExT. कौन सा batch पहला होगा? Which batch is going to be the first to give the NExT? Not specified. Will NExT happen in 2023? Not specified. So please, everything that you hear is going to be a probable batch and a probable year. Number two, next one is going to serve as a licentiate exam as well as a PG entrance exam. A licentiate exam is basically when you cross this exam, only then you will get the permission to add the name DI dot and get the permanent license to practice medicine in India. Third, NExT will apply to all IMGs and FMGs. NEET and NExT, what the government has said in a very specific statement is that they are planning to, first of all, cease NEET when NExT starts. This is simple. But also they have added a disclaimer that in some areas, if there is a lot of resistance, so they might have to run NEET as well as NExT till those previous batches are basically finished. And then from the new batches, next will eventually take over NEET. So there are high chances that batches before 18, 17, 16, these might have to give NEET only, and maybe 19 onwards or 20 onwards, they will have NExT only. Next one is going to be an online MCQ based theoretical exam, having one or more than one type of MCQ. The exam is going to have 6 papers with 2 sessions per day over 3 days. Pre-lunch, we have 120 questions in 3 hours. Post-lunch, we have 60 questions in 1.5 hours. The very first day, we have medicine and allied subjects. Now, allied subjects include anything that can come under medicine: physiology, pharma, micro, biochem, then psychiatry, then basically dermatology. Second day, post-lunch, we have pediatrics. Second day, we have surgery and allied subjects, followed by ENT. Third day, we have obs and gynae, followed by ophthalmology. All right, this is going to be the 6-part, 2 session per day, 3-day examination. Now they have added very specifically that applied aspect of first, second, and third year subjects are also going to be asked in these particular exams only. All right, eligibility. Now please understand, although they are replacing your final professional with what? Next one. The clinicals and the practical exam of both third and final year will take place as they used to take place. There are no changes. Okay, there are no changes. So you have to complete third and fourth MBBS course from your medical college. Only then you shall be eligible for next one. Next one will happen how? There will be a regular step one with these 6 exams. Let's suppose you fail in any one of them. Okay, one or more. If you fail, you will be allowed to give the supplementary step one. Let's suppose you again fail in supplementary step one, then you will be allowed to give the exam only next year. Okay, there will be no second exam or anything. Both will be held once a year. If you fail in both, you shall appear in next one regular following year. Okay. This is one particular point, that is the 10th point is basically what is, I will say, troubling students a lot. The 10-year rule. What is the 10-year rule? No restriction to the number of attempts if a student has passed both step 1 and step 2 exams within 10 years of joining MBBS. Now, what does that mean? Basically, let's suppose you have joined in 2020. So by 2030, you have to pass, you have to clear both next one and next two. If you can do that, in the subsequent following reattempts, that number becomes unlimited. So that 10-year rule doesn't apply to number of attempts. It simply applies to that you have to clear next one and next two within next 10 years. If you clear that, then number of attempts is like unlimited. Go on, 2020, 32, 33, 34, whatever amount is. What I believe, the government has not specified, but what I believe that this particular point will be applied to the first batch, which gives the next. So it can be 19, 20, 21, whichever batch the government thinks is going to give the first next one. This particular 10-year rule will apply to those only. The previous batches like 7, 8, 9, 11, 12, you guys, I don't think you guys need to worry. You will be allowed to give the exam as normal only, because you are already in MBBS and you are giving this exam as a PG entrance exam only. All right, now coming to next two. Next two has a bit of a twist this time. The best part is that the government has actually cleared everything regarding the next two. Okay, next two is going to be a practical clinical viva voce. Okay, I'm so sorry I missed this important point. 11th point. Please let's put our thought on the 11th point. This is a very important point. There is no restriction to the number of attempts to appear in next step one regular examination. But if you have to improve the score, you can reattempt the next one examination only after 1 year of completion of next step two. Basically, after you clear the internship, you have to give the next two, and then you have to wait for 1 year. Only then you can appear for the reattempt examination. You cannot appear before that. All right. Let's suppose you get a good next one score. That means that score shall be carried with you for the next 3 years. That score shall be carried with you for the next 3 years. This is one point. Second major point that is again becoming a problem for the students is what they mean by average out. So let's suppose you appear for, let's suppose you clear next step two, you appear for a reattempt. Then you do not get a good score, then you again appear for the reattempt. Now you have given 3 consecutive reattempts. If you now want to have a final score, then what will happen? The average of these 3 attempts will be counted, and that average score shall be your final score. So when you appear for counseling, that average score shall be counted. Now it has both pros and cons. The pros is, of course, that if a student has not, if a student, एक खराब हुआ, अगले 2 अच्छे हो गए, automatic the score goes up, and let's suppose एक अच्छा था, 2 खराब हो गए, the score goes down. So the risk is in both pros and cons. Coming to next two. Next two is going to be a practical clinical viva voce examination. It is going to be a face-to-face live exam, and it is going to be of what? Medicine, surgery, obs, gynae, ENT, optha, peds, ortho plus PMR. So these are the 7 subjects which are the clarity in step 2 examination. The examination is going to be objectively structured. In short words, it is going to test what you have learned during the internship, whether you have learned to communicate with the patient or not. This is going to be the basis of this particular examination. It will be again conducted in regular NExT step 2 and supplementary NExT step 2. Here is one twist. In NExT step 1, let's suppose if you fail in 1 or 6, you shall be allowed to sit in supplementary. But in this particular step 2, if you fail in more than 3 subjects, you shall not be allowed to sit in the supplementary. You have to wait for 1 full year and then give the examination again. Okay, please note this down. If you fail in more than 3 subjects, you have to give the complete NExT step 2 examination again. You shall not be allowed to sit in the supplementary. Less than 3, you simply have to sit in the exam in which you have failed. All right. NExT score. Raw score is basically what you have, the score that you have got shall be counted as a whole number. That particular score shall be the only eligibility criteria for PG entrance. No other score shall be counted. The raw score is the basis, is the main thing that shall be counted. NExT step 2 is going to be a simple pass and fail exam. The minimum score to pass NExT step 1 is going to be 50% or 50th percentile. The government has given both the numbers clearly. They have not specified which one they are going to choose. You have to pass individually in every subject to be counted. Let's suppose you failed in medicine and now you have given supplementary medicine. So when you have to make your final score, your regular step 1 score, the regular medicine score shall be substituted by the supplementary score. The supplementary score is the one which is going to be counted in your final raw score. So it's a good thing for people. Let's suppose you perform very good in supplementary. So you will not be in the disadvantage. For a candidate with multiple attempts, average of the last 3 consecutive results shall be counted. NExT score is valid for the next 3 years. Now, to get a provisional registration for Indian medical graduate, you need 2 things. Number 1, you need to clear NExT 1 and you need to pass your university practical exams. Second, for foreign medical graduates, for new foreign medical graduates who are coming back, now you have to, if you want to get a registration in India, you have to clear NExT 1, internship, compulsory internship in India, and you have to complete NExT 2. Yes, all the FMGs, the new FMGs have to do all the 3 things. Let's suppose you are a previous passed out FMG and you simply have to, you are simply working in India or you have crossed FMG, something like that. You only have to appear for NExT 1 as a PG entrance exam. All right, you only have to appear for NExT 1 for the previous FMGs, old FMGs. New FMGs, you have to clear NExT 1, internship, and NExT 2 in India. Now, if you are thinking to go for USMLE PLAB, you still want to be counted as an Indian medical doctor. You need to make sure that you have done NExT 1, internship, and NExT 2 in India. If you have cleared all the 3 things, you shall always be considered as an Indian medical doctor, and you can very well go ahead and do for USMLE, PLAB, Australia, anywhere you want. Only raw marks obtained in NExT 1 are required for PG counseling. They have added one more twist. Now, raw score shall also be utilized in employment, scholarship, and fellowships. This was not done till now. So basically, your final year marks are going to be the biggest criteria with whether you will get the next big job or not. Okay, so this is a very big twist that has happened in India now with the NExT 1. Now, considering NExT 1 question pattern, it is basically clinical vignettes will dominate. They have increased the percentage of problem-solving questions to 65%. Comprehensive, they have decreased from 30 to 25%, and recall is now 10%. Level of knowledge, I think this can be very well. I will request sir in some time to actually, tell us in detail about what is must know 60%, nice to know 30%, and may know 10%. Paper distribution. Now, 10% is going to be from basic sciences, that is first and second year subjects. 10% is going to be PSM. FM and PSM shall come as an integrated question. A break of 2 hours will be given between two sessions. Basically, pre-lunch and post-lunch will have a break of 2 hours. So that means your average single day in this exam is going to be 3 hours plus 2 hours plus 1.5 hours. So imagine a 6.5 hour exam day. It's going to be very, very hectic. Next two is going to have an evaluation method which is going to have actual cases, OSCE, and simulation. Simulation, I think, basically is going to be difficult, but let's see what happens. Schedule is not cleared yet. What they have proposed till now, what was going to be the timeline? Please note that they have not specified the year. They have just given a general timeline. The proposed is next one regular will happen in second week of December. Supply, I think, will happen in third and fourth week of December. Fourth prof practical in your own college is going to happen in first week of January. Internship will start from 1st February. Next step 2 will happen second week of March. PG admission will start. PG admission, the counseling will happen in May, June. Again, I have told in my video also that it is too ambitious. We have seen the last 3 counselings, but let's see what the government has planned. And PG course will start from 1st July. The points which are not clear in NMC draft, what will happen with the post interns? Will need cease to happen? When will the first next one be conducted? Which exam in 2024? And will December 2023 FMG happen? These, we all in the whole country right now have probable answers to these only. So please do not take our word as a final word here, because nobody, the NMC has not specified any clarity on these particular points. Rest, I think I have told very clearly, and I think now we can get to the question. Sir, if I may request, if you can tell us about, sir, the next one question part on the level of knowledge, sir.
Yeah, before we go ahead, so hello everyone. I just want to give my brief overview. Can we remove the share, Dr. Nachiket? Yeah. So before we start, I just want to tell those who are going for a March 2023 NEET PG, I think you should not waste time. I think you need to continue because your NEET exam is going to be on schedule. So there's no denying about that. Now, as far as the rest of the students, I think there's no need to be having any apprehension. And we've been following major changes it's been almost 2 decades that I've been involved in the system. A lot of major changes have happened. And historically, I just want to tell you a few perspectives as to what was the need for them to come up with these kind of, changes before we start answering your questions. So one is around 2004, 2005, there was a major hurdle that the number of PG seats in India were very less. And there was a lot of thing all over the country. And then they decided one very simple idea that each guide, that is each professor, can have 2 students. Okay, so each thesis guide can have 2 students. Directly around 2006, 2007, the PG seats got doubled. So that was a major change that happened in the PG system. Secondly, around 2010, 2011, they came up with a very important thing that we have to restructure our preparation. One thing around 2005 to 2010, major thing observed by everybody was that people are not doing internship. Okay, internship being the most important year where people are posted in various departments. They have to learn to become a comprehensive, complete doctor. Internship is a very critical thing. There are many colleges where people used to, avoid going to internship and just stay in the library and prepare because of this entrance exam. So I just want to share. Can I share my screen, Dr. Nachiket?
Sure, sir. Please.
Yeah.
Ritika, please. Sir, chal raha aapka?
Can you see this? Okay. So this is, I don't know whether the share is visible. Is it visible now? Is the share visible?
Yes, sir, visible.
Okay. So, so what I wanted to show was, see, 2011 March, they came up with a major booklet, and that was about the Vision 2015. This Vision 2015, I remember a lot of discussion happened. We did a lot of sessions. A lot of things going on. But this Vision 2015, when they came up in 2011, the major thing that they pointed out was that people are not doing internship, and that was the biggest point that this booklet was trying to point out. So one of the recommendation was, let's start asking in the entrance exam questions that only interns can answer, not people who are studying in the library can answer. So they started asking, if the blood is spilled on the floor, how do you wipe it? If there is normal saline, what does it contain? How do you wash your hands? How do you do pap smear? What are the tips to do? Meaning they try to ensure that people who are working as interns have an advantage, and people who are not working as interns, in the sense who are only studying the library and studying, they should have a disadvantage. So that was the major point that came across in 2011. And by 2015, we saw that in the exams, major changes had happened. Particularly INICT took it up very actively, and the AIMS exam at that time, they started asking questions mainly connected with people who are working as interns. Despite this, there was a lot of issue. They said that keep interns are still boycotting the internship, still studying in the library for the PG exam. So to avoid all this, one of the brilliant suggestion what they came up with was, let's keep the exam before the internship. And that was the reason why this major changes are happening. So all these efforts and all these things, it is not something new. It has started from 2007 onwards. 2011, they came up with the first booklet, Vision 2015. Then subsequently more, as we saw, more updates kept on coming. So we have reached this stage now where we have come up with one very important idea. No matter what we do, people are not attending internship seriously. They are too interested in studying for the entrance exams. So let us get the students back to internship. That is the main goal. So in order to achieve that, they started coming up with this pattern. So now we have a NExT coming up. So next one is there. Next two is going to be there. Now there are still in a draft state. Nothing is conclusive. They have asked for recommendations from all the stakeholders, mainly the students, I think, and you also can give your suggestions. Everybody is giving, and all the sensible people that I spoke to about this major changes. One major issue everybody is having is this 3 years average is a big drawback. So what is this averages? Supposing, let's say, a student gives the exam in his final year and he is not getting a very good score, but let's say the next year he gives, that past exam is tagging on with him, and that score is going to be pulled down because of the previous year. So this is something that is unacceptable, because let's say the student was not well when he gave the first exam. If he was not well when he gave the first exam, then he gives another exam to improve his score. But that fact that he was not well the previous exam, that is going to spoil his life, because no matter what he does in the future, that previous exam average is going to be pulled down. So this is a major thing I think they have overlooked, and I think they are going to change. So everybody is putting forward the recommendation, and I hopefully that they will consider it, that one bad exam should not spoil the entire career of a student. So that's, I think, something which is haphazardly done. I think the 3-year average we are all recommending should be scrapped. The second major hurdle that will be there is they are planning to have NEET separately and the NExT exam separately. Now, in this, when you're giving counseling and giving seats, how will they try to equate the scores? Now, we already saw 2011-12 when the NEET started. NEET used to be conducted multiple sessions in a day, morning session, evening session, and we used to have sessions for 10 days. So many exams. And there they had come up with a very nice software which gives discriminative index, difficulty index, and equating scores were there. So something similar is what we are anticipating they'll do, so that the equating scores are there between the NEET exam and the exam that is there, that the next one students are giving. So that is still yet to be worked out, and that I think is a major hiccup that they'll face. So we are looking forward how they'll solve it. Now, one more major hiccup I think that will be there is across the country, internship dates are not uniform. In South India, we see internship gets over in March, April. In many of the northern states, in Delhi, I think the internship gets over much earlier. So how they will try to get the uniformity, this is another major hiccup they'll face, and they have to solve this problem somehow, because if they are keeping uniform dates across the country, and this is something that they have to look at. The third big issue is this 10-year rule. It's not they have not clarified clearly what do they mean by 10 years. But anyway, it will not be applicable for students who are before 2019 batch. I think only after 2019 batch, if at all, this 10-year rule might be applicable. But it doesn't make any sense. And previously also we saw that when they tried to put age bar for giving PG exams, the court scrapped it. So I don't think this 10-year rule anyway will work. Anyway, we have to wait and see. This is still a draft state. So finally, after all this, before we start answering your questions, I want to tell you one thing, that they are now saying that you should look at the clinical subjects for the preparation. And now it's been almost 23 years now since I've been teaching. And I can tell you, in my classes, I have seen the most brilliant students are those who are really very strong in their basic sciences. You really can't bypass the basic sciences, subjects like patho, micropharmac. I'm talking particularly for those students who are in their first year, second year. At least for you people, don't start picking up final year subjects and start reading them from now. because that is going to be counterproductive. You really can't build medicine without your basic sciences. You can't build your surgery without anatomy. You can't build medicine without sound knowledge of patho, physio, and micro and pharmac. So my advice is ki overall, at the end of it, things will not change much. So all this hype and apprehension, and so many people are talking about on the YouTube, we're also discussing it. But I'm telling you, at the end of the day, nothing will change. Things will continue as they are. In South India, I can tell for people from South, the things will be just as they were, because anyway, in Karnataka, one thing we have noticed is people give their internship very sincerely, at least in Bangalore Medical College. And after the internship gets over, they take 1 year off and they prepare for entrance. And that is exactly what is going to happen now. Just that the average part that they have got, if it's scrapped, then you're back to where we were. We are going to have the same thing. You attend our internship sincerely. After one year after internship, you prepare sincerely, as you've been doing all these days. I'm talking about people in South. You prepare seriously 1 year after the internship, and then you give the exam, just like how you've been doing all these years. So for you, the life will not change at all. It's the same thing. Now, as far as the apprehensions are there, see, when we had the NEET started, when AIMS used to conduct the exam, until 2011, AIMS conducted the exam. So I don't know whether you are aware of the details. 2009, 10, and 11, 3 consecutive years, the paper leaked. We used to have a paper-based exam those days. Online exam was not there. And as the question paper leaked, I think it was a major, 2011 was a major issue. The CBI was involved, and there were so many things happening. 2012, they decided that we'll have an online exam and we'll do it part by part. We'll do it multiple sessions. So I remember at that time when the change happened. See, anytime change happens, it's always going to trigger apprehension, some kind of confusion. That's but natural. But eventually, at the end of the day, I'm telling you, it will not change anything. You're still back to the same subjects. You still have to know the 19 subjects that are there in your undergraduate curriculum. If you are sincere, if you are focused on your subjects, if you understood the pre-para subjects, then you will start falling in love with the clinical subjects. You'll understand it better. You'll love it. You'll start liking it. So that will be a joy rather than a tedious process. So we are back to what we have been doing. Nothing will change overall. The subjects are the same. It doesn't matter what kind of exam they're going to give. Ultimately, if you have understood the subject, cracking the exam will not have any variation. There's no need to get any apprehension at all. So we are discussing the whole thing just to reduce our apprehension, reduce our anxiety, because this is not going to have any impact at all. Don't worry about it. Okay, as you've been doing, continue. Now, I remember 2012, I did a session where the NEET exam had changed the pattern. They started asking, see, they had to do 10 sessions, so I think 15 sessions for our exam, where they were making only 200 questions or 300 questions. They had to make around 4,000 questions. And when somebody has to make 4,000 questions in a hurried way, naturally the quality of questions will suffer. They started asking, what is the speed of a fly? What is the percentage of road traffic accident in children? And all kinds of weird questions. People started showing images of scientists and asked, what did he get the Nobel Prize for? So those kind of questions also came. And I remember discussing in my classes, you don't have to worry about those kind of questions at all. Just focus on understanding of the core concepts in our subjects, and keeping that in base, your ranks will not change. You will get, and what students we saw who are doing well in the class eventually did get the top ranks. So what I've realized over the years is the change in pattern is not going to affect the students who are genuine, who are sincere, will eventually get through. So it will not make any difference. And all this apprehension and thing, don't worry about it. The whole process is to simplify it. They're trying to simplify it. It may have initial hiccups, I agree. But in the long run, this might be better for our country, because overall, people pass through their MBBS. They pass through the garden, they walk through the garden and came off like that. They pass through MBBS. Actually, they have to pass the NEET exam or the NExT exam. And that's when they really study. So overall, I think the health standards of a country are going up because of the kind of question they're asking. So in general, Dr. Nachiket asked me, you should know, must know questions, may know questions, those kind of things. Now, anything that can kill the patient obviously is a must know thing. Meaning, if you do that, you're going to harm the patient. You have a patient with diabetic ketoacidosis, that patient's potassium is low. You can't start that patient on insulin. You start the patient on insulin, the potassium will come down further. You're going to kill the patient. Now, that's a must know thing. You are actually going to kill the patient there. So anything that is must know, anything that is dangerous, harmful to the patient, if the student does not know this, as a doctor, if he doesn't know it, then that is asking for trouble. You have a patient with say myoclonic epilepsy, and you're giving carbamazepine in the treatment. Now that's a dangerous thing. You're actually going to worsen the patient there. So there are some things that are must know, that you should know, that can really affect the patient's life significantly. So those are how they are categorizing. You must know stuff, and then may know stuff. May know may not impact the patient's life that much, but the must know definitely is going to be really significant. It can be harmful to some extent, that can kill the patient. So in general, that is the theme. Now, yeah, there are specifics that they have highlighted. These are the stuff that is must know. There are stuff that are may know. There are the stuff that if the student, if he knows, is good. Now they are categorizing it. They have given specific areas, but the point is the general theme is built on this idea that this is how the must know and the may know kind of division is done. I think, Dr. Nachiket, we can look at the questions now.
Sure, sir. And with this, I like to add one more point that I'm going to actually send to the NMC, is that they have stated that NExT is going to be governed by the State Health Commission. And in areas where they do not have the State Health Commission, universities will take actually charge on that. So that's a very unfair point. Because if it starts happening, then it becomes a one-sided exam completely. There is no point in failing students from the university itself. This is one point the government needs to take care. Apart from that, sir has beautifully explained everything. We'll start taking the questions. Yes, my friends, most probably 99.9% INICT and NExT will merge. There's not going to be a separate INICT exam. June FMG will happen. December, we are not sure, as I've stated very clearly to you. Now comes to the question. I think Rajat sir is answering the questions here itself.
Yeah, we are really missing Dr. Ajit. I think it would have been great if he was here. Actually, he's traveling, so he could not join us.
Yes. So I think is sir about 2018 batch students should concentrate on FMG or NExT, sir? I think for 2018 batch, if you are giving the June FMG, please focus on June FMG. If you are thinking about December, then most probably what I believe in myself that it's going to be NExT. So, but right now you need to focus on all the 19 subjects. Sir, if you want to add something on this.
Yeah, as I said earlier, overall the exam may change, but the question subject will not change. The pattern of questions may change a little bit, but overall the subject will not change. Either way, what they are suggesting seems to be sensible. And this is what everybody's been raising the point from, the very early years itself. You can't ask factual questions. In an era where all of us are carrying Android phones and iPhones, data is not a limitation. You should not ask silly questions about what is the gene involved in, say, primary pulmonary hypertension. Is it BMPR1 gene, BMPR2 gene, BMPR3 gene? What kind of nonsense question is that? Now, we don't want that kind of question because that's all database stuff. We are not limited with data now with the kind of equipment that we hold on our hands. So what we want is, if a patient presented with these kind of features, what is the likely diagnosis? How are you going to assess it? If it's a patient with sepsis, what is the first main management that you do? What is your assessment in sepsis? What kind of antibiotics you will start? So basically, the general information that is required for a doctor is not connected with data per se. Yeah, there are certain things that every doctor must know. No, those are bare minimum things that we required. But asking some kind of vague gene name or some kind of vague thing, I think that all that will go. The way they are recommending now, almost 60 to 70% questions are going to be problem solving. Then they are saying that recall based questions are going to be significantly reduced. So less than 10% questions recall based. So I think this is going to really solve the headache of many students. And actually anxiety should come down because of this. And generally we have realized that the first set of exams that happen now, they'll not be that difficult. So the people who are going to be giving, don't worry at all. The first set of exams generally will be much more easier. It's once the exam gets over, then they have the headache of making the second paper much more, tougher and different than the first one. And that's when the pattern and the whole thing starts becoming more severe or more difficult. My assessment is you don't have to worry. As I said, getting anxious is not the solution to your problem. Those who are first year, let's address the thing. Those who are already old students, you are going to be giving NEET exam. At least they are saying NEET will be there for a few more years. So you don't have to worry at all. You just continue with your NEET and you focus on your NEET, don't bother. Now, those who are from 2019 onwards batch, you may have the NExT exam. Now, those who are in the first year, second year students, the more recent 2021, 2022 batches, you focus on the subjects that you have. Those who are in first year, focus on first year subjects. Those who are in second year, focus on your second year subjects. So your main thing, keep it simple. What subjects you have that year, focus on that. Now, you can have a general perception. Yes, when I'm reading anatomy, I want to read some clinical part of it. When I'm reading patho, I'm doing some clinical, association along with that. Yeah, you can do that. Definitely, you need to do that. But don't boycott or bypass those subjects, because without pre-para, you cannot build up strong clinical base. So those who are already in the final year, I think then you are the the water is already under the bridge. Means you can't have much to do with the previous and now. Now you just stick to the final year subjects, and in the final year subjects, they have given the division of branches now, and your focus should be on understanding the subject. Either way, as I said, the factual questions are going to come down, so your headache is not there. So I think things are going to be much more brighter for the students and less burdensome. And I think those who are really having some sensible approach, rather than those who are memorizing stuff and vomiting, those will be filtered out. Those who are having some grasp of the subject definitely should be anxiety free. You're going to do well. The June INICT, I think, will happen on time. Okay, in fact, most of you who are giving the March NEET, I think you might be the best prepared students to give the June INICT. And the moment the NEET PG gets over, don't take a large break. Continue, and I'm sure you'll have a very good chance of giving the INICT. Because the thing is, this November, December, the INICT that happened November 1, many students were still preparing and they could not have completed the portion. I think for most of you, particularly the people who are going for the March NEET, you will have the June INICT as the best attempt. So you really need to give, obviously don't put everything for INICT. Your main target should be NEET, because that has got the highest number of seats. And after that, you can definitely give a serious attempt for the INICT.
Yes, INICT. Yes, INICT June, as Dr. Rajat has clearly said, will happen for sure. FMG June, yes, we can expect. December, November, there is no clarity. All right, so please, again, I'm requesting each one of you, please do not ask many people. If somebody says yes, do not take that yes as an answer. There is no clarity on that. We still have to wait for government clarification on this.
Yeah,
Okay.
Nasima is asking if PG seat allocation is based on X1, no need for conducting NEET. No, what they are saying is the students before 2019 batch, um, they can continue with NEET for a few more years. Okay, they are considering continuing the NEET for some more year, because the first NEET next exam when it will happen, those students are not going to pick up, those undergraduates will not pick up the seat immediately. They have to finish internship, right? So there will be a parallel NEET, because those students have to join the same year. So I think there's no denying that 2023 NEET is definitely happening. 2024, my feeling, will surely happen. Chances are very high that it will happen. And the reason why I'm feeling that it will happen, one, they have put it in the draft itself that NEET will, be done parallelly. That's the draft itself is suggesting. And secondly, I think the NEET is going to help them decide to take the seat that particular year. That particular year seats also have to be filled, isn't it?
Sir, as an academic question, sir, what do you think shall be the main academic difference between NEET and NEXT? Basically, do you think the difficulty level
I
will
feel the
change?
way they are suggesting is what everybody has been asking for from past 20 years, and that is stop asking factual questions. Database questions are useless. Don't ask some vague gene name, some vague syndrome. That's nonsense. It's about time that we stopped. The good thing that happened was earlier we used to have a lot of state exams, and many of the state exams, earlier used to go neck to neck competition as to which is the worst exam in the country, and some of the states used to win. And they used to ask all kinds of idiotic questions. I remember them asking ki exenatide drug is derived from which animal. Now that is absolutely useless for a doctor. I mean, if he's working in a hospital, he should know how to put the pathophysio in mind and then approach the patient. The approach, the evaluation, there's nothing connected with knowing what animal the drug was derived from. So I really think those kind of questions have come down significantly. In my 22 years of teaching, what I've noticed is things are becoming better. And right now they are promising that recall questions will significantly come down. So I think the factual questions, if they're coming down, then it will be conceptual. It will be a clinical based pattern, where if a patient is coming, even if they have to ask an anatomy question, they have to make it in a clinical pattern. It's a patient who's got a road traffic accident, he's got a hematoma compressing brachial plexus. So what cord is going to likely be affected? It might end up ultimately to be an anatomy question, but it's built on a clinical base. So I think that will make it much more interesting. It will not be that tedious, trying to memorize stuff only for the exam and not bothering to remember it for the rest of their life. that unnecessary wastage of effort to just memorize for the exam, that will go away. So my feeling is NExT is going to be making the students' life much better. Maybe the first few batches, as the hiccups we discussed, those hiccups are going to be a problem. Agreed. For the conducting board also, there are a lot of hiccups to bother about. The first few years, how they'll do it, I don't know. But the transition phase is a little difficult. Once it passes through, subsequent batches, I think, will feel more comfortable with this kind of exam than what was happening previously. That's my main assessment.
Absolutely, sir. I think so. The biggest change would be, of course, the timing of that examination. The whole system is now going to change. But sir, my question again was that do you think do you think that, sir, if a student is preparing for NEET, for example, March 2023, and the same student is going to prepare for, let's suppose, next happen next year. So do you think he or she needs some kind of change in strategy? Will the difficulty level of both the examinations, apart from the number of questions and the structure of the examination, will the difficulty level of both the exam remain the same, or will next be a tad more difficult?
I really feel the first set of exam that will happen, no, that is the first NExT exam that might happen, might not be that difficult. But they'll also realize that once the exam gets over, the people will come back, they'll recall the questions, that questions will come out, and then they'll have to do some changes in the subsequent years. My feeling is that first 2-3 years, when the NExT happens, it might not be that difficult. They might ask base level questions. Don't forget that they have to cover all the colleges in our country, and that includes private colleges. It includes everything. So they can't keep an exam at the level of AIMS. They have to make it accessible for everybody. So my feeling is that it will not be that difficult, the first set of exams. Maybe in the subsequent future, they will have to do something to make it more tougher, but maybe not. It may not be the case in the first exam. So those who are preparing for the NEET exam now, if you first of all don't allow that feeling to come ki we are going to give an exam after this. Your job is to get through now and not to be caught up in the anxiety of a new exam later. But those who don't make it through in this NEET, then whether the next NEET happens or you are going to be facing next exam, that's still a far off thing. But the major changes I would say is obviously the focus should be more on clinical than pre-para. But this, as I said, that doesn't mean pre-para is not important. It is. But for the current year, for the people who are finishing NEET, going for the next exam, I think for them, definitely they should focus more on the final year subjects. That will be the one major change that might happen. But at the
Perfect,
same
sir.
time, I want to emphasize once again, those who are in first year, second year MBBS, don't start preparing for final year. Stick to the subjects that you have now. Those who are in anat biochem physio, that those subjects are important. Without understanding biochemistry, you will not understand clinical medicine. Without understanding insulin and hormonal actions, what hormones are acting way, how the interaction is metabolic pathways, without understanding that, you will not understand diabetes and diabetic ketoacidosis and hyperglycemic syndromes. That understanding, without understanding, means you're memorizing, and anything memorizing means it will not hold. It'll be very difficult for you to retain. So ultimately, we are emphasizing the same thing. You need to understand the subject, and if you want to enjoy your subjects, you want to fall in love with your subjects, then basic sciences become a must. So you have to do the basic sciences. But those who are currently in the final year preparing now, I think stick to final year, because that's where the thing is now. That's where they are focusing on.
All right, sir. I think, guys, I'll just put a recap to what all we have discussed today. First of all, the next when will happen, which batch will happen, it is not clarified, but what we believe, what our assumption is basically, and please note I'm emphasizing the word assumption here. The 2019 batch can be the first batch to give the next. For post interns, although they have not given any clarity, but there are chances that NEET and next might run parallelly. If they do run, then NEET is the exam that you have to give. Let's suppose they cancel NEET and only next is there, then the post interns do not have to give next two or do the internship again. They simply have to give next one as a PG entrance exam, and based on that score, they will get the seat. Let's suppose for FMGs. So if a new FMG is entering India, he or she has to clear next one compulsory internship in India, no matter where you have come from, and then next two. Only then you shall be considered as a permanent doctor in India. For eligibility to get a provisional degree for Indian medical graduates, the new Indian medical graduates, you have to clear next one as well as a practical exam. Coming to the third thing, next one, the score that you get in next one shall be the only score utilized for PG entrance exam, PG entrance counseling. No other, no practical score or anything is required there. Your next one score, when you give it, shall be valid and will remain with you for the next 3 years. In any subsequent counseling, you can produce that score, and the government will happily give you the seat available at that score. Let's suppose you want to reattempt to improve your score. So you can reattempt only 1 year after you have completed next two. You do next one, internship, next two. 1 year after next two, you can reattempt the next one examination to improve your score. Now, if you have to go to the counseling, then the average, the mean score of your last three consecutive attempts shall be counted as your final score. Okay, it's good, it's bad, it's both. Let's suppose you have failed in one subject and next one, you give the supply examination. The score of that supply shall substitute the regular exam, and then the particular conclusive score will be there. In next two, if you fail in more than three subjects, you shall not be allowed to give the supplementary exam. You have to wait for 1 full year and then give the examination again. So this is one of a twist. Apart from that, I believe, just 1 second. Next two we have already told. And if you want to go overseas for USMLE PLAG, you have to clear next one internship and next two in India to remain an Indian in the Indian Medical Register. FMGs have to clear next one in internship in India. And I think with this, we come to a final conclusion. And please
Yeah.
note, NEET PG is going to happen. It is not going to be postponed. And INI-CET, when next will happen, INI-CET will be merged with next. So June FMG and June INI-CET are happening. December, there is no clarity. So with that, I think
I
my
just
work
want
here is
to
done. Sir, please, please.
Yeah. I just wanted to say, see, as any kind of new exam that happens, that anxiety will definitely come. I remember entering the hall in 2012, and many students had this apprehension. Sir, they're asking photographs, of scientists. I mean, they're asking and they showed a picture of a person and asked, he got a Nobel Prize for what? So people had started creating folders on their, laptops of a person with a beard. He's got a cigar, that sigmoid fluid. He's got a dog by the side. His, this thing. So I realized that if they start doing all that and start memorizing all kind of nonsense, then it will not have any benefit at all. So my assessment at that time also, don't worry about all these things. Just stick to the subject. The subject will not change. Just focus on your subject. Just understand the core concepts of subject. See, entrance is at one side. The first job is to become a good doctor. To understand that, to become a good doctor in the first place, your core understanding of the subjects will not change. So all these entrance exams aside, first step is to just become a better doctor, and you focus on that. You start, falling in love with the subject. You stick to that. Don't get too apprehensive about all these exams. This is just a passing phase, and don't worry about it. When it comes, we'll handle it. I am sure, at least our students, we are going to prepare you in such a way that you should not have any problems in handling any exam, because ultimately what we're discussing in our classes is the core understanding of a subject, and that will not change. Once you're prepared with that, once you understand the subject, then I don't think you should have any apprehension in whatever exam comes your way. So with this, I'll end. I think my best wishes to all of you. Good luck and all the best.
And guys, if you want to connect with us over WhatsApp, my number is 844-7956-222. You can WhatsApp me anytime regarding any of your next queries, and I'll personally make sure that I'll take advices from sir and give you an answer back on that. So with that, this session comes to an end. A very happy new year, and may next year bring you all the happiness in the world. And this is just some phase, so don't worry about it. The complete Bhatia team is standing with you. Thank you so much and best of
Happy
luck.
New Year again. Happy New Year to everybody.